Welcome everybody. My name is Knut Detlefsen and I represent the Friedrich Ebert Foundation. And today we're going to have an event on how the response to COVID-19, the pandemic that moves us all, that has turned around the world, and how we deal with politics, has revealed maybe weaknesses in our social safety nets, and how social democrats across the Atlantic are discussing that and how we're going to overcome those shortcomings. The Friedrich Ebert Foundation is a global social democratic network. It's a German political foundation that tries to connect social democrats and progressives around the world to come up with innovative policy solutions and make us stronger as a political movement. And our office in Washington, D.C. works in North America. That means in the US and Canada. And we try to build a progressive transatlantic dialogue. And today we have two great participants, Andrea Horwath, who is a leader for the Canadian Social Democrats, who is the official opposition leader in Ontario and leads our sister party there. And we have Katarina Barley, who is a German and European leader for the Social Democrats. She was a cabinet minister. She was a Secretary General for the German Social Democrats and is now the Vice President of the European Parliament and also, of course, a member of such. And I look forward to this very important discussion in our digital series that we are doing now. So I hope we're going to have a very interesting and candid discussion. And I turn it over to my wonderful colleague Jordan, who helps us organize and represent the Friedrich Ebert Foundation in Canada.
Thank you so much, Knut. This is certainly a really great opportunity to make sure that we're building on that dialogue between Germany and Canada. And so today, I'd like to begin the conversation with a bit of a general question. COVID-19 has really shaken the foundations of a lot of the social safety nets all around the world. And we have seen it reveal that it is not maybe in fact an equal opportunity crisis, but one that deepens existing inequalities. So I was hoping, and maybe we'll start with you, Katarina, that we could talk a little bit about what you're seeing in your work and what gaps in the social safety net this crisis has revealed and how that's impacting ordinary people.
In the European Union at the moment, we're focusing quite a lot on what's happening within the Union, but it is so important to look overseas and to see what is happening elsewhere, to learn from one another. And because of the structure of the European Union, of course, we are probably facing more inequalities in the first place than, for example, a country like Canada or others, because we have very, very different member states. That the ability to cope with the crisis, of course, was very different and has impacted the population very differently. We have seen that those countries who were particularly hit by the crisis were those who had been hit by the financial crisis before the worst. And that may be the reaction, this is my interpretation, the reaction by the European Union in the austerity that was imposed to these countries, because they had to, for example, cut the fundings of their health system. And we have great unemployment rates in these, youth unemployment especially in these countries. So the families live closer together, the young people stay a lot longer with their parents and grandparents, which also worsen the situation. So we have inequality in the first place, social inequality in the first place. We have different possibilities of the countries reacting to it. Germany has released a huge safety package with also social benefits. We have, for example, already seen in the last crisis compensation for shortening your working time, then the state compensates. We see that a lot of other measures are being taken, which is not everywhere the case. I think globally is that women are affected more than men, as well as the crisis itself concerns, as the responsibility to cope with it. I mean, it's mothers, it's caretakers, it's nurses, it's so we have an inequality between men and women. We see that we have solidarity in the meantime between member states. Education, there we are very concerned because the kids that, because of homeschooling for so long, of course the kids from households that are better off have even better chances now, and the ones that are not so well off, who don't have maybe so sophisticated digital devices, this gap is widening even more. So we have lots of issues concerning the COVID crisis and social issues.
And I think that there are some themes there that are really resonant. And Andrea, maybe you could speak particularly to how this crisis has deepened or made worse some of the existing cuts and the impacts of austerity. I know this is something that we're dealing with in Ontario, as well as the challenges around education and caregiving.
And then thanks very much for organizing this this talk. I think it's a great opportunity to do exactly that, to kind of identify where there's some commonalities in terms of the impact of COVID-19, you know, from the perspective of Ontario and Canada, and to kind of look at what's happening in the European Union and get a sense of how we're all trying to deal with that as Social Democrats. And I can say that in Ontario, with the Conservative government in place, tragically, what happened to us is that the Conservative government was literally starting to dismantle our public health system at the very time that the COVID-19 pandemic hit our province. And so we've not had the kind of response that other provinces have been able to put together. Our government has been very, the Conservative government, very slow to act, very mixed in its messages, it's been very challenging because they have also not been willing, as fiscal conservatives that they are, they're just not willing to use you know, Ontario funds or Ontario public funds to do anything really to help shore people up. So while the federal government has provided some overall programs in Ontario, we haven't seen the government here step up to do anything really to provide direct help to people. And so where other provinces have, for example, almost immediately provided some income support for folks, not so in Ontario. Of course, then the federal programs rolled out, and still Ontario hasn't done anything to help everyday people with their ability to pay the bills. And of course, folks have lost jobs. So just as Katarina was saying, the same thing here in Ontario are you know, the people hit hardest, of course, are women, but also gig economy workers. And so people, the first businesses to close down were restaurants and bars and entertainment and those kinds of sectors. And so those folks are largely, you know, the younger people, more precarious workers. So that was one piece. These are also folks who then couldn't pay their rent. And in big cities like Toronto and other big cities, it's become quite troubling to see that the provincial government has not helped in that regard. There's been a commitment around you know, not allowing anybody to be evicted, but there is no legislation, really. There's a moratorium on evictions, but many tenants now are, of course, gathering up months and months of arrears of rent. And the government is now, at this moment, primed to change the law so that a landlord can evict a tenant in arrear. If a tenant has put together an agreement with the landlord on, you know, on arrears and a repayment plan, if they breach that plan, they can be evicted immediately for breaching the plan, which is just, it's going so far backwards in terms of housing security and tenants' rights. But I mean, that's just tenants. The same thing with landlords. We've been asking the government as Social Democrats, let's shore people up. Let's give people some rent assistance. Let's shore up our small business sector and give some commercial rent assistance and really help us get through it so that when we get to the other side, the damage won't be as deep for individuals and families or for businesses, particularly SMEs. But of course, they're a conservative government, so we haven't seen any of that. And of course, all of the same things Katarina talked about in terms of kids and the education system, we still don't know what that's going to look like. And the inequities, interestingly enough, in our province are, I mean, it's not dissimilar except that we have parts of our province that literally don't even have access to the internet, where there is no broadband, like where kids cannot even, log on to do any kind of e-learning or distance learning. I mean, it's the inequities are quite troubling. And again, in some areas, the school boards have been able to find resources for less well-off children, for low-income kids. In other areas, school boards have not been able to do that, and the government of Ontario, of course, hands off as they are, was not prepared to step up and help with that either. So and these are the kinds of things that are going to cause lasting problems for families and for people. Childcare is a big issue here. We don't have a universal childcare program. Our childcare centers have been told they can reopen, but they've been given no support from the government to reopen. And of course, they're going to have many fewer children than in past years. And so really what's happening is that the childcare system that was already fragmented and a patchwork type of system is literally falling apart. And the government has no interest in whatsoever in shoring it up or in making sure that that the centers, the childcare centers, get what they need to provide that important service. And so what does that mean? It means, once again, most of those ECEs, early childhood educators, are women. So those jobs are going to be gone. But also, how are families going to replenish their income and get back into the workforce if there's no childcare available? And at the other end, when people are saying, well, September is coming, kids will go back to school, that's not really happening. It's one of the things that the government's talking about is that they'll perhaps have alternating days of school. Well, if there's no childcare and there's alternating days of school, then who is it that's going to be taking care of the children on those alternating days, school-age children? Well, of course, it's going to be women. So we're going to go into a deep economic crisis. We're already in it. We're certainly looking at a significant constriction of growth, and so GDP. And so then what do? We end up putting women on the front lines of that hardship. So there will be no recovery without a she-covery, is what we're saying. It's definitely going to be a she session.
But the idea that some governments are using this crisis as an opportunity to roll back rights. And I know that we're seeing that manifest in the European Union, and we're seeing it in Ontario in some different ways with workers. But maybe, Katarina, could you talk briefly about what you're seeing in Europe?
We do see a rollback also in the European Union. Yeah, it's like Andrea said, every government shows now its true face, as we say in German. The ones that always wanted to cut down workers' rights now try to do so. The ones who are not interested in women's rights now pick upon that. And another aspect that I would like to introduce, because it's my field of interest, is the rule of law and democracy. We are seeing countries, especially I have to say, usual suspects, Poland and Hungary, who are taking advantage of the crisis to abolish democratic standards, to change election laws, to abolish the separation of powers and the independence of justice even more, to restrict the freedom of media. So it's not only Poland and Hungary, it's also other countries, but this is extremely disturbing because, I mean, the European Union being as complicated as it is, you do need common values that you agree upon, and if you have member states that infringe these, or that say openly that they are not interested in keeping, for example, an independent justice, then you're in real trouble. So yes, we have seen governments taking advantage of the crisis, and we are starting the German presidency on the 1st of July, and we all hope that this presidency will be able to back this development down.
Andrea, could you touch a little bit briefly on how workers' rights in Ontario have been impacted by the crisis and by the Ford government's decisions?
Well, you know, it's very frustrating here in Ontario because we are headed in a backwards direction on so many levels. But with workers particularly, I mean, the former Liberal government here in Ontario, which lost power 2 years ago, pretty much, they made some very I would say small steps towards more workers' rights in our province. Under great pressure, I think, trying to save their political bacon, more or less. But at the end of the day, what we ended up with was at least a couple of days of paid sick day, for example. I'm going to use that one as an example, so that people could take 2 paid sick days off. We were asking for much more than that, obviously, but the Liberals landed on only 2 days. So you could take more days off unpaid, but 2 days of paid sick days without losing your job. The Conservative government came into office and immediately rolled back any of those gains or any of those achievements that had been won under the previous government. So we go into a pandemic where Ontarians are not protected to take time off when you're sick. I mean, in fact, the government rolled things back so badly here in Ontario that they actually went back to decades ago when you used to have to present a sick note to your employer from your physician to prove that you were off sick legitimately. So even taking time off sick was not something that was where your job was protected unless you could bring a sick note in to prove that, which every health agency and health expert around the world has identified it's just bad policy. It's bad public health policy. So of course we go into a pandemic and you know, people don't have any opportunity to take sick time off. And we've been pushing, of course, to reinstate paid sick days. And we've used this kind of opportunity that the pandemic has once again highlighted, that people need to be able to not bring their illnesses into the workplace and to then spread that illness through the workplace and to potential, you know, customers and clients, depending on what kind of a workplace it is, as well as co-workers and employers. And so, I mean, this is one example of the erosion of workers' rights. But the other thing that's been highlighted now here in Ontario very recently is workers who never had any rights. So we have migrant workers here who come, of course, from Mexico and other countries to help with the farming of our crops. We have, you know, an amazing agricultural sector, but it's being held up by workers who have very few rights. And now COVID-19, because these workers live on farms in congregate living settings, is ravaging, you know, some of the farms. And we've had 3 deaths of migrant workers now in Ontario. But the reason being is because nobody bothered, the government didn't bother to make any attempts at ensuring that those types of workplaces and those types of settings were going to be safe and people were going to be distanced, and there was going to be any kind of, there was nothing put in place for testing or for isolation or anything at all. And so of course now these workers are at great risk, and our food supply is at great risk. And what it really highlights is that we have been, I mean, these workers have pretty much, you know, been exploited for, you know, as part of our, I mean, it's structurally, I mean, it's part of our agricultural sector. And so there's a lot of, I think a lot of identification of the way these workers have been treated over time. I don't, unfortunately, think that there's going to be much change, though, not with this government.
Yes, and I know that that's an issue that has also come up in Germany, which is migrant workers and rights and dealing with COVID within that community. So I'm going to move us now to a slightly more forward-looking part of the discussion, and I'll start with you, Andrea. What I'm hoping that we can talk a little bit about is, very briefly, as we're looking forward as progressives, how do we need to be rebuilding? What are the things that you're working on so that we can rebuild better, and that this crisis, you know, isn't just something that's hitting ordinary people and leaving them behind, but is perhaps an opportunity to change some of the systems that we see are now not meeting people's needs? So I'll start with you, Andrea, on that.
Sure. Well, absolutely. And thanks, thanks very much. You know, one of the things that we were doing, that New Democrats were doing, we had been working on the what we called the Green New Democratic Deal, which is the, you know, the changing of our economy to a green economy. We had put together a paper, if you will, a broad consultation ensued, and we were at the point of actually, you know, launching our plan for a just recovery and a green recovery when COVID hit. I mean, literally, we were going to release it in April. So what COVID has done then has given us really an imperative to kind of step back and look at how now do we change our perspective on our Green New Democratic Deal to try to incorporate some of the things we've been talking about around not just the green economy, but a green economy where people are at the center of everything that's happening, right? And where we have more equality, and we have better wages, and we have, you know, a distribution of wealth that's much more just. And so we've pulled it back now, and we're sending it back out for further consultation to hone that into a document that's more reflective of some of the lessons we've learned here in Ontario around COVID, but in particularly, you know, gig economy workers and part-time workers and the precarity of work. But I do want to say that one of the things we've learned is also in our healthcare system where the gaps are, and some of our most important workers in our healthcare system who have been overlooked as well in terms of their quality of work and their wages. And so our long-term care system, and I know this has happened in many other countries, was very fragile. It was in a crisis in the first place. But of course, COVID ravaged the long-term care system, and we now call our personal support workers, the folks that day in and day out work to keep our loved ones safe and provide for their needs in long-term care. We now call them heroes, but they are part-time workers. They're workers that don't have benefits largely and don't have full-time work, and so they travel amongst various facilities, and so they're mostly women, and they're mostly racialized women, right? And so we're really working on that as well, and trying to overhaul long-term care as is, because it needs to be overhauled. This is an opportunity to do that, but also to acknowledge and recognize, who is it in that system, and not just that system, but of course, clerks in grocery stores, for example, folks that work in pharmacies. I mean, there's a lot of people who kept working while others were not working in order to keep our communities going. And all of these folks are the lowest paid workers. And so those workers then go home to their families, and not dissimilar to what Katarina was saying earlier. Lots of times they're larger families, they're in suburban communities where the cost of living is a little bit lower than in the big cities. But now, where we see there's still hotspots of COVID-19 in our province, those are the areas where those hotspots exist, where those lower wage workers live, right? So there's a whole piece around that. And as I already talked about, the other big issue is around childcare. What can we do coming out of COVID-19 to really step up and make sure that we have a childcare system that serves the needs of families and children?
So critical. Thanks, Andrea. And Katarina, maybe if I can turn it over to you, I feel like some of the themes that Andrea was talking about related to green recovery connect up well with the work that you've been doing in Europe. Would you be able to talk a little bit about that?
Well, the situation there is quite similar. We were heading for the new Green Deal, as we call it, in the European Union, and I hope that we can actually keep it up. It is at least the will of the Commission and the Parliament, 2 out of 3 of the major institutions, that we do so, because now we are seeing great amounts of money being released to battle the consequences of the COVID crisis, and they are supposed to be linked to the priorities that we set before the crisis, which was the new Green Deal, climate protection and sustainability, but also a digital development. I mean, we also have areas where you barely have internet access, but also social rights. And here, I think we really have to understand this crisis also as a chance. It does lay open the problems that we had before. And it is about, as Andrea said, it's about the care sector. They're not paid enough. Their working conditions are not good enough. The Social Democrats believe that it is too much profit oriented. It should be a public sector in public interest. The gender pay gap is one issue that can be tackled on the European level, and we will. We will hold the Commission to its word there. It is still 17% in the European Union. It's 21% in Germany. And as Andrea said, and we all mentioned, women are really carrying the burden in this crisis, and everybody acknowledges that now, but we have to draw the consequences. And we do see some progress in social rights. As I said, we have the system in Germany that if you have to shorten your working hours because of a crisis, which can be any crisis, then you get state aid so that you can keep your job, and the company can still pay you a little, but it keeps its workers, and it can reboost and restart immediately when the crisis is over. So it's a benefit for everyone. And we're going to introduce that now in Europe, for the whole of Europe. We're sticking to implementing the minimum wage scheme in Europe, which we don't have in every member state. So we do, as Social Democrats especially, try to take this crisis as a chance and really use this focus that there is at the moment on the needs of people to improve our legislation.
Thank you, Katarina. It's very interesting to see some of the really strong connections between the work that you're both doing on different sides of the Atlantic. And I'm hopeful maybe we can bring you together for an update in a few months again. I'm just